right. Well, welcome everyone. Welcome to Working It Out, PorchLight's monthly webinar series, where we bring panelists together to discuss the issues that affect our workforce. My name is Jessica Myers, CEO of PorchLight, and today our subject is exploring solutions in South Dakota's childcare crisis. Before we get started, I'd like to share a little bit about PorchLight and what we do. PorchLight's focus is in rural workforce development, and we approach this in three different ways. First, we work with candidates through resume writing and interview prep. Next, we partner with companies and organizations that either have a rural footprint or want to hire rural employees. And lastly, we come alongside rural communities to conduct support services in strategic planning, housing studies, community assessments, and our very own PorchLight certification reserved for communities with populations of 5,000 and fewer. I share all of this to say we understand rural. We come from rural communities, and we see the incredible opportunity in our rural areas. In the past year, PorchLight had the great pleasure of assisting 3 communities conduct childcare research projects. Through the planning grants provided by the Governor's Office of Economic Development, Highmore, Salem, and Elevate Rapid City were able to conduct crucial research that resulted in funding for a childcare center in Highmore that we'll hear about today, a much needed after school program in Salem, and the Black Hills learned the impact of childcare on productivity and absenteeism in the workplace. So let's get started. To kick off the webinar, I'm going to pass it over to our Director of Policy and Communities here at PorchLight, Burke Ermintrout.
Hey everyone, my name is Burke. I am excited to kick things off today. So what today's going to look like is that we will hear from each of our 3 great panelists, and then we'll have an opportunity for Q&A. So as you listen to each of our panelists present, we encourage you, please put questions in the Q&A chat box. You'll be able to see the Q&A box where you can put questions in, and we'll be pulling questions from there. Put those in at any time, and then once each of the panelists has had a chance to present, we'll have some time for all 3 of them to respond to the questions you ask. So put your questions in there anytime, and we'll get to those toward the end. So first, I'm excited to introduce our first speaker, Representative Erin Healy. Assistant Minority Leader Erin Healy is serving in her 3rd term as a state representative in the South Dakota legislature from Sioux Falls, where she has been active on childcare issues. She serves on the State Affairs, Health and Human Services, and Legislative Procedure Committees. Representative Healy.
Thanks, Burke. Hi, everyone. Thanks for that introduction. So I'm going to basically kick us off talking about several challenges that we're seeing here in South Dakota, both for childcare and in early learning. We definitely see some national trends here in our state. So basically, the high cost of childcare in South Dakota, it's a substantial burden for many families. It's placing it out of reach for those who need it most. So just for an example, in South Dakota, the expense of infant care is incredibly high, and it can sometimes exceed the cost of in-state college tuition. So based on recent data, infant care can cost around $8,000 to $12,000 for a family, and that depends on the location and the quality of care. But just for context, tuition at a state university in South Dakota, that can cost around $9,000 per year. So for families in need of full-time childcare while they work, the annual expense is comparable to or even exceeds the amount that they would be, the annual expense that they would have if they were sending their kid to college. And I really think that creates a stark reality when higher education costs more. We already know that higher education is a well-known burden for people, but when childcare costs more than even our tuition for higher education, we know that that's a huge problem. There's also a lot of agencies. I think the Department of Health and Human Services, they suggest that childcare should not exceed 7% of a family's income. And the reality in South Dakota is that our families are paying much more, usually around 20% of a household income. And that's incredibly high. And we know that means that there's going to be some trade-offs for families there's going to be some trade-offs, especially for mothers. They're going to find that the expense of childcare, it's nearly canceling out the income that they would earn by working, and that's leading them to drop out of the workforce or take part-time roles. And I'm in healthcare myself, and we see this amongst nurses. There's so many nurses that aren't in the industry, and we see a nursing shortage for that's not the only reason why, but one of the reasons why is because it's so incredibly difficult to find childcare for their families, and it's just not expensive, and it makes more sense, or it's just not an expense that they can have, and it makes more sense to stay home. I also want to address that there's, like I said, workforce shortages and staffing challenges. So childcare providers themselves are facing really serious difficulties in attracting and retaining qualified staff. And that's because of the combination of low wages. And it's a really challenging work environment. We know that a lot of these folks who work in childcare are getting paid a pretty low wage. And it can be comparable to entry-level retail or even fast food positions. And these people are caring for your children. Their responsibilities include ensuring safety for your kids and supporting their early development. The disparity that we see in the amount of money that they're receiving for their services, it can be demoralizing for workers because they're doing such hard work. So of course they're going to seek better paying jobs in other sectors. So really the challenge of maintaining a stable workforce, it's compounded by the lack of benefits. They don't receive health insurance or retirement plans. It's also making these roles less attractive. One other thing that I would really like to focus on today, being in the legislature, is some of our recent quality and regulation challenges. So South Dakota, we have fewer regulatory requirements for childcare centers than other states. And this, while we might be able to have more facilities because of this, that doesn't mean that it's going to be safer. So for example, recently last year, we changed some of our administrative rules. So it's easier for those providers to be able to be licensed. So for example, ratios, we just increased ratios. So in-home providers can now, instead of 2 infants, they can have 3 infants. But what's really, I think, dangerous about that is how do you save 3 infants in case of a fire? Which infant do you choose not to pick up? Like, you only have 2 arms. So that's really concerning to me that we're changing these ratios based off of our needs while we're compromising the safety of our kids. Another example of how we've recently changed our regulatory requirements, we have decreased the amount of training. So prior to last year, I believe 20 hours were required by licensed professionals of training. And we've reduced that to 10 hours every year. And that training, that includes SIDS, safe sleep, food allergies, emergencies, reporting child abuse, shaken baby syndrome. So that 20 hours is truly learning how to take the best care of these kids. And when we reduce that to 10, we really need to consider the quality and the safety of kids. It's concerning that we're considering making the regulatory burdens, we're lessening them, but I do believe that that's going to have a negative impact on safety. And then I want to address also why progress has been slow in our state legislature. So one, our political ideology. South Dakota's political landscape, it's largely conservative, and there's a really strong emphasis on limited government intervention. And so many state legislators that I work with and political leaders, they really prioritize reducing government spending. They prioritize maintaining low taxes and also, like I just mentioned, minimizing those regulatory burdens. But this ideology can be really difficult when we need to gather support for programs that would require increased state investment or expanded regulation in childcare. Proposals like state-funded pre-K, and I'm not suggesting that we do that, but just proposals of something like that, or even increased subsidies for childcare, it's often viewed as expanding our role in government in areas that we traditionally have left to the private sector. And that's why we haven't seen any progress here in South Dakota, one of the reasons. Another reason is in South Dakota, there's a really strong emphasis on traditional family roles. It is really common to hear that one parent, especially the mother, should stay home with their young kids. And this cultural perspective really influences how lawmakers view the issue of childcare, because some believe that the solution lies more on family or faith or personal based solutions rather than state intervention. So this viewpoint, it can lead to resistance because as we shift away from family values and traditional family values, or we move toward increased dependence or government support, we're going to see this ideology butt heads with us. I also think there's a lack of widespread public awareness about how bad this problem actually is in South Dakota, the severity of childcare crisis. And that really makes it hard to generate these thoughts and ideas and even like legislation around this in our legislature. Also, this is a really complex issue, as I'm sure you're going to learn today. So the economics of childcare, it really is a challenge in crafting effective legislation. Childcare providers, as you're going to hear from Kayla, I'm sure, they operate on thin margins, and their primary expense, like wages and facilities, it's really high. So simply subsidizing families, it might not fully address the financial struggles of providers. And initiatives to raise wages for childcare workers, that would require, it probably will require significant state investment that we're just not able to really focus in on today. And finally, as it's kind of related to my previous points, but there is a reluctance in expanding social services. Our political climate here tends to be skeptical of expanding social services, especially those that aim at supporting low-income families. So the reluctance can make it really difficult to pass a bill that would, for example, increase eligibility for childcare assistance or expand the scope of programs. Let's just say Head Start, for example. That's a good example of an early learning program that we have here in the state of South Dakota that is federally funded. So some legislators, they argue that expanding these services could lead to increased dependency on government support, or it could discourage private sector solutions. And this perspective also leads to the preference for market-driven approaches, even in cases where the market has failed to provide affordable child care options like we've seen in South Dakota. So those are just a few of the concerns that I, as a legislator, and me and many of my colleagues have, especially when it comes to the challenges of wanting to bring legislation, but really having to take a step back at times to try to build the foundation, try to build the message so people really understand why this is an issue here in South Dakota, and the many, again, multifaceted approaches that we can take to solving this issue. And that's all I've got for you today.
Awesome. Thank you, Representative Healy. Our next speaker is Kayla Klein. With nearly 2 decades of experience in the child care sector, Kayla Klein has been the contracted director for Early Learners South Dakota for the past 5 years. With her leadership, she has helped to establish Early Learners South Dakota, a program of SEDACY, to ensure that it is an efficient and reliable resource for early learning professionals and advocates throughout South Dakota. She's an expert in the field and has been a passionate advocate for childcare and early learning for the last 14 years. She's also helped to facilitate important statewide events such as the annual Early Learner Summit and the annual Children's Day at the Capitol, as well as policy and lobbying efforts. Kayla, I'd like to welcome you to present now.
Well, thank you very much. First and foremost, thank you to Jessica and her team at PorchLight for allowing me to speak today. This is a topic I am very passionate about. So just to kind of give you a little bit of a background, as he mentioned, I am contracted to be the director of Early Learner South Dakota. I do have my company, Klein Visioneering Group, or KVG, where we have worked with some communities specifically on the childcare piece. Early Learner South Dakota is a statewide advocacy organization, which is a program of SDAYC, and our focus is twofold. So we look at the grassroots bottom-up approach, where we're working with communities and individuals, and then a top-down approach where we're working more with like those bills and legislation, administrative rule change, and trying to find ways to have the top-down approach where it positively affects everyone throughout South Dakota. So blending those two things together, we hope will make impactful change. First and foremost, I do these types of presentations about community, business, and statewide solutions. Usually they're about an hour, so I'm going to try to pack a lot of information into one, but I do want to know that I'm happy to share out my email. So if anyone would like to get in touch with me to find additional resources, I'm happy to be that resource to you through the Early Learner South Dakota work. So as Erin mentioned, first I want to talk a little bit about the realities of the situation. So I always kind of mention why is it that we should care across sectors? So we're not just looking at the childcare sector, which I spent about 8 years as a nonprofit childcare director. So I have direct experience knowing what it's like to try and manage one of those that type of program. And this is where I really found my passion for advocacy. But why is it that it's no longer just a field issue? Well, a recent report done by Ready Nation shows that we lose on an annual basis in South Dakota approximately $329 million per year. And that's just with parents unable to come to work. Maybe their childcare programs are closing, their kiddos are sick and having to leave early. So it is an issue that we're seeing across the sector. We also have to realize that childcare is the workforce behind the workforce. Childcare is what allows many of these families to go to work. They need reliable, safe care in order to feel comfortable with the care of their children while they're at work. Now, another thing I wanted to touch on, Representative Healy mentioned, is that the concept is that women should stay home. The reason why that is really not quite the valid argument here in South Dakota is because we have 80% of mothers with children under the age of 6 are in our labor force. That is a massive percentage. And as Representative Healy mentioned, we're already having a workforce shortage. So if you remove that 80%, what's that going to do to the workforce shortage? It's going to make it even worse. So that's also something to keep in mind. Now, childcare is an absolute tangled web, and there is definitely not a silver bullet. That's the one thing I really try to make sure that folks understand. There's not one solution. It needs to be a multifaceted, cross-sector solution. There needs to be innovations happening within businesses, at the community level, and state investment happening. All three of those things need to happen in order to truly make this work. Now, why is it such a tangled web? Well, a lot of it is because we have a childcare. You probably hear some folks saying that it's a broken business model. I like to call it an unsustainable business model, and here's why. So, when you think of childcare, the one product that childcare has is providing care for children. So that means that a provider is, let's think of a retail store. If inflation has cost your product to go up, maybe a t-shirt, it's double the price, right? You're not going to keep selling it for the same price. You're going to find a way to increase so it doesn't affect your profit margin at the end of the year, right? Well, that is how it should be for childcare as well. But as Representative Healy pointed out, the amount that parents are paying for childcare in South Dakota is already unattainable for many of the parents who are here in South Dakota working already. So it can be sustainable, but how I try to explain it to folks is that if a childcare provider were to be sustainable, let's say they have wage parity to a school district. On average, right now, childcare providers in South Dakota are getting paid on average $12.27 on average. You can get more than that working in fast food or retail, when this should really be thought of a profession. These individuals, these educators, are caring for, watching, and educating our most youngest and vulnerable individuals, who are our children 0 to 5. And so it should be respected, but they're making $12.27 on average. And you would put that together with burnout, and that makes this field very unappealing for a lot of reasons. So in order to kind of have, if a provider wants to pay wage parity to a school district and they want to maybe add benefits in a quality program, like I said, it can be sustainable, but they need to start doubling what they're charging families. Now, obviously, we know that that's not going to be an option for providers, or for families, is seeing that childcare price double, right, within a very short period of time. So what is it that we can do? So a few different things we've worked with some communities on is the one, you can find a couple different resources on our website, on the Early Learner South Dakota website. And there's the Childcare Business Solutions document. You can find that on the Early Learner South Dakota website. And then there's also what we call the Employer Childcare Toolkit. So let's first start with some employer solutions here, just some basics. So if you're looking at employer-based solutions, you can have something as simple as, and something that would potentially not cost an employer anything, but flexible scheduling. So thinking of those as just working within the school hours, that type of thing. And also maybe allowing some more remote work for families in order to have that flexible scheduling or pickup time, because as we also know, childcare doesn't stop when your child is 5, right? So my youngest is 8. I still don't want him staying home alone. And so he needs care after school, or I or his father need to be there with him in order for us to feel okay about that. So flexible scheduling, remote work options, a dependent savings account. So you could, an individual, it works exactly like a health savings account that many employers offer already. You can contribute up to $5,000 into that account, or an employer could go a step further. One of the employers we work with, Pioneer Bank and Trust, they specifically have the $5,000, they give $5,000 per employee, not per child, but per employee, and they actually pay the provider directly. So the parent has a choice where to take their child, whether it be in-home or center-based, and then they actually pay that provider the fees up to $5,000. So we, in our solutions document and on that childcare employer toolkit site that we've created, there is a wide array of tools that businesses specifically can use. We've also created a free survey in there that you can use just to survey your employees. That's another very free, low-hanging fruit employers can look at, is what is it that your employees need? What are they wanting? See if there is something that you can implement at a relatively low to no cost, if cost is potentially a barrier for your business. All right, so now going back to community-driven solutions. So remember, I mentioned that this was a threefold solution here. So some of the communities we've worked with, the first thing I hear a lot from economic development and businesses are, oh, well, we're gonna just gift a building, or we're just gonna give a building to a community. First and foremost, I'm not saying that's a bad idea. So I want to make sure I'm very clear on that. But I also like to warn people that there may be unintended consequences of doing something like that. It is not just the building that makes childcare an unsustainable business, as I've mentioned. So the next thing you have to worry about, the biggest expense childcare workers have to be concerned about is the cost of payroll. So you've heard of the workforce shortage throughout South Dakota. Well, the workforce shortage in childcare specifically is even worse. Many childcare centers that I work with aren't even operating at 100% capacity. Sometimes they're not even operating at 50% capacity because they can't find the employees to work in the facility. So you see classrooms sitting empty. They can take another, let's say, 20 to 40 kids, but they can't find the teachers, educators to actually be in those classrooms in order to fill those spots. So I'm not saying it's not a good idea to gift a building or find a building, raise money for a building. That is probably part of the problem, but you need to make sure that you're charging the right rates once you get that building, and that there are actually employees and individuals available to work, because obviously in childcare, remote work is not an option. You have to be physically available to be working with those kids, and you need to have reliable staff in order to be there every day. So there are some other considerations that a community could take. So maybe you do have a building, you go with that option. A couple of things that Rapid City has specifically piloted is a scholarship program. So this is completely funded by the John T. Vakurovich Foundation. They've created a scholarship program where if a family doesn't qualify for childcare assistance, they can apply for the scholarship, and then the fund pays for them to go to this. Now, if that's not necessarily an option, and obviously not every community in South Dakota has a John T. Vakurovich Foundation, but the one thing you could do is like a co-investment strategy with different employers within the community. So I've also heard from a lot of business folks where they say, well, we don't want to make that business level investment, giving that $5,000, for example, to an employee. Well, instead, what you could do is have co-investments come together and then create a fund. Maybe you just have one childcare center in your community. That would make it easier. And then you can help with operational funds to offset the cost and to ensure sustainability of the program. Just letting providers know about all the resources that are available in South Dakota. There's a resource hub that has a ton of information. Anyone, any provider who is, I believe you don't even have to be licensed or registered for this, but it's through SDSU. You can get access, SDSU Extension and the Enrichment Office out of Brookings has helped put this together. And any provider, they have tons of business templates and things like that available on this hub. The enrichment centers, there are 5 of them around the state. They provide nearly free resources and help to childcare providers, and letting providers know about childcare assistance. That is the one source. It's a federal flow-through dollars, and if you are licensed or registered, you can access those dollars as a provider. Those are just a few, and then of course, I know I think I'm over time here, so I'm going to wrap up by saying the third and last thing we need for sure is a state investment. We need all 3 of those things to be working simultaneously in order to actually improve these issues in South Dakota. I will say it again, I have many, many, many more resources, so if you would like to email me, you sure can. It's Kayla, Kayla, at Klein, KLEINVG.com, or visit the Early Learner South Dakota website for a ton of additional information. And the last thing I can say is hang in there. I know this is hard, this is a challenge, but there are a lot of really innovative, cool things happening around the state. And I'm sure you will get there and find those solutions for your community. And thank you again for the time today.
Wonderful. Thank you, Kayla, for that presentation. And I don't think any of us mind if you went a little over time. I wasn't watching the clock, but it was jam-packed full of good information. So thank you. Our next panelist and our final panelist is Brandi Pekarek. Brandi moved to Highmore in 2012, and the old childcare center was right across the road when she lived in town. And she remembers thinking it was a shame that it did not work. Highmore has been through 3 daycares that have closed since then. And with only a few daycares in town, everyone gets a little panicky when one closes for a day. The town came together exactly a year ago and knew that childcare was a big problem. From then on, a group came together to work on a big grant that just came out and did the training to get to where they are today, which Brandi is going to tell you a little bit about. So welcome, Brandi. We're excited to hear from you.
Thank you, Burke. And thank you, PorchLight, for having me today to explain our journey through this crazy crisis that we have, not just here in Highmore, but everywhere in the state of South Dakota. So like you said, when I first moved here, there was no Head Start, daycare center, after school program. I actually first started taking my son to work with me. Thankfully, I had bosses that allowed that because I didn't know, everybody was full. I couldn't get in anywhere. And then all of a sudden, I just happened to fall into this lady who had just opened up daycare. We didn't think it was probably going to last long because after her youngest came to preschool age, we figured that she would maybe leave the daycare and move on with a job that has health insurance, because I mean it's hard to survive out there without health insurance. So then once she closed down, I kind of went into a spin and called my another daycare provider right away and was able to get in, thankfully. And since then there were 2 more daycares that had closed just because of the fact that I think that they're, you know, like Kayla had said, they're just burnt out. And they need insurance, they need just to go on. And so now we have 2 unlicensed daycares and 1 license. So like you said, if one closes, you got to hope that they have an opening spot. And like I said before, thankfully when that would happen, I could bring them here, because you never know, at 6 o'clock you're gonna get a phone call or a text saying, hey, I gotta close today because I got a sick kid, and you're scrambling. So I'd been kind of talking to some people about the childcare crisis, and I happened to reach out to my girl Clover over at Hand in Hand Daycare Center over in Miller, and asked her what the first steps were that they took to start up a community center. And you know, because that's wasn't really my comfort zone, but somebody's got to step out of their comfort zone to make a difference. And so so then after that happened, the CNC, actually a couple of the members came to me and was like, would you like to be a part of this meeting? We got the mayor involved, and we're gonna pull a public meeting to see what we can do about this crisis. And that actually morning of the meeting came out the grant for the planning and implementation grant for the childcare crisis. And so we were like, we got to act now. Are we all in this or not in this, or what can we do to help this crisis that we have? And so I invited Clover over to help us with all the information that we could start with. And a pastor had just moved to town, actually, and she had previously she had started a daycare center from the ground up in Nebraska. And so she was playing in her favorite sandbox, she said. And so she was able to direct us a lot towards the directions that we needed to go, and just knew so much about the policies and all the restrictions and everything. So from there, we had a sign up sheet and asked people who is willing to step in and help us with this grant. So we formed a committee, and in that planning part of the grant, we signed up for board training through the SDSU Extension Office. And that was one of the biggest, best things that we could have done, because they helped us so much, because most of us had not been on boards, and they helped us form a strategic plan to build this from the ground up to help with our bylaws and getting losing my thoughts and words here. But the not being a nonprofit. So they helped us do all of that. We had lots of Sunday afternoons and late nights of training, and we really got to know each other more than we probably really wanted to, but we all got along, and what one person couldn't offer, the other one could. And if somebody didn't know somebody, the other person did, and we just made it work. And so we got the planning grant, and so our next step was to go for the implementation part of the grant. So we reached out to employees and we got support letters. We got PorchLight involved. Thank you guys. They help us put together the survey to conduct all of the numbers of people who would need childcare in the summertime. And how many, like the age groups of them, and would you want an after school program? And we came back with a lot of great statistics from that, and that helped us point us towards a direction that we needed to go. So once we started doing the implementation grant, we had to submit all the things, and we got the grant, and we couldn't have been more happy and surprised by the amount that we got. And when the community saw that, though, they didn't quite understand how we couldn't like build something with that. And like, we can't physically build anything because there isn't a grant out there that allows us to do that. But it allows us to put everything inside to get things for inside the daycare center. And we had a lot of doubts in the community saying, well, we had it before and it didn't work. And we're like, well, that's then, this is now. We want to build this community. We need to have somewhere for people to bring kids, like taking their kids to Miller or Pier. That's not an option that we need to have if we want to make this community better and build it up. So we even reach out, like, we're not here to take away from those in-home providers. We're here to help them. We encourage them to raise their prices, to become licensed so they can get state aid for meals. We didn't want to take anything away from them. We just wanted to be there for them, to help ease off the pressure that they have because of only having a couple providers. And it's a lot. So yeah, so in the daycare center, it was a scramble. We were like, this implementation grant, we got it, but we only have till September to get everything put together, to build up our clientele. And so we actually fell into an old building that the pastor had just purchased. And so we started going to work. We got all these contractors in, and they did the flooring, they did construction, we got the plumbers in there, and just completely flipped this place inside out. Long nights of painting and everything. And it just makes your heart happy each day that you got closer to it. And then all the bookshelves, the books, all the other fun toys that the kids get to play with, and the activities. And we were actually also able to go through ProCare to get that for the daycare center. And I had made the hard decision to not send my child to preschool this year. And so I pulled him from the daycare provider because she kind of had a lot on her hands, I felt. And I chose to take him to the daycare center for the fact that they have the curriculum that would help him improve with the preschool. And it's just amazing how you can already see the little details of like even coloring. And he wants to read now. And by the time when I get home as a working mom, he doesn't want to do that with me. He just wants to play and not have to worry about stuff, just kind of like kids coming home from school. So it's just so nice. You get notifications, pictures of what they're doing. You know what they eat. For infants, you know when they pee, they poop, they eat, and all that stuff. And as a first-time mom, that is so comforting to know. And daycare centers, you're able to have that because there's not just a one provider. Like you said, like how are you going to save all these kids? Well, that's why having multiple people, it just helps so much. You're able to go for a walk without having to trail along infants. It's just, it's been quite a process and we're getting there. We're hoping to build more of our clientele, and we just need the community to trust us and to believe in us and that this is going to work, and we need you to help make it work. So I guess if there's anything else I can add, I don't know. I hope I didn't skip anything.
Awesome. Thank you, Brandi. Great to get that perspective on Highmore and understand what your journey has been as a community to get to this place with your new center. So at this point, I will invite each of our panelists to turn on your camera. We're going to do a little bit of Q&A here. And so for all of our attendees, if you have questions you have for our panelists, please put them in the Q&A box, and we will do our best to make sure they get answered. But I can go ahead and get us started here with one for whoever wants to take this. But can you talk a little bit about, it was brought up earlier, but about how childcare assistance works in South Dakota, who's eligible for it, and how does it affect our providers?
Erin, do you want me to take that one? Okay. Yeah, so childcare assistance. So first of all, sorry, federal dollars. They are federal flow-through dollars, and they come to the Department of Social Services. The state has to match a certain percentage of those dollars. Once they do that, the funds are then distributed to providers. Couple caveats to that. A provider has to be licensed or registered in order to accept childcare assistance, or you cannot have it. And then it's reimbursed based on the income level of the family, and generally also based on the age. Like the rate in which you're reimbursed as a provider is based on the age. So to qualify, you have to be at, you can't be above the 209% the poverty level. So that's very, very low. So it is quite hard for people to qualify. However, I will say that new numbers as of today, I just got these stats, is we have all children under the age of 18 in South Dakota. Of them, 31,000 actually qualify for childcare assistance. The kind of horrifying fact is that only 7% of children are actually receiving childcare assistance. That means not a lot of kiddos are accessing it. So what does that mean? Or why is that? A lot of times it's because providers don't take childcare assistance, or they're not eligible to take childcare assistance because they're unregistered or unregulated. Why would they be and 60% of our market in South Dakota is unregulated. So that just automatically disqualifies them. Sometimes childcare assistance isn't worth it to the provider because the reimbursement rates are so low. And that's something we worked on with Senator Reed last year, and many other legislators actually, during the last legislative session, to have a true cost of care study done. It passed out of state affairs wonderfully, but DSS negotiated with Senator Reed, and they did the study. The results of that will be out this month. And why that's important is because it's reimbursement rates are calculated based on the market rate. So do you remember when I said that we're charging a low rate and we're not charging what we should in order to be a sustainable business in childcare? The market rate is the unsustainable rate. So the state's reimbursing at a non-sustainable rate, if that makes sense. And the goal of many legislators is to have DSS reimburse at a cost of care rate rather than a market rate. And providers, sometimes depending on the parents' income levels, They're real, like, for example, for some of the families I worked with, they'd have such a high copay. The copay was all as much as I was charging on a weekly rate. So sometimes even if they do get childcare assistance, it really doesn't make it worth it to have it because their copay is so high.
Thank you, Kayla. Does anyone else want to add anything on that? You don't have to, but okay. The next question I've got here is about one of the things with childcare is that we think a lot about quality, but as we're trying to think about affordability and availability of childcare, as we're experiencing issues with that, how does quality and some of the regulations in South Dakota, how is that affecting our ability to put forth quality or affordable and available childcare? How are providers experiencing that? How is the state kind of looking at that?
I can take it and then, oh, sorry, Representative Healy, I saw you come off mute.
How, you go first and then I can pepper in some comments.
Perfect. Yeah, so the first thing I would say is that this is a bit of a twofold issue because I do kind of want to touch on what Ashley mentioned in her question too with this. So South Dakota has relatively low requirements for being registered and licensed. So we are the highest state. You can have 12 children before you are required to become registered with the state. Registered means in-home, licensed means center. Group family is also licensed. So that's why I say both. And that is the next highest state is 9. So we have the highest threshold for where you can care for that many children in your home without being registered. And DSS really has kind of like just minimum health and safety requirements. There really isn't too much of a quality component. Now, the one thing I will say about that is they are doing what's called the QRIS or Quality Rating Improvement System pilot. And that is something almost every other state has besides South Dakota. It is still currently a pilot. That's where the resource hub comes from. That's truly looking at quality. So we as advocates are really pushing for that. But what we know is it's not just about, in South Dakota, you can take children and you can literally plop them in front of a TV and let them sit there all day. That we know is not quality. It's not best for a child's brain development. The most neural connections are happening for a child between birth and age 5. 80% of their neural connections in their brain are being made within that time frame. It's extremely critical. And if certain connections are not met within that certain time frame, they can be lost to a child forever. So that's why, yes, we need care. Yes, we need more availability, but we also need to have the quality. Now, to hit on what Ashley mentioned in her question just briefly, some of the regulations are not just Department of Social Services. Some of them are like the Department of Health or local fire marshals, or like there's different local restrictions that make it hard to register a house. And an in-home childcare, like a family day is what we call that, being registered. Those regulations are a lot easier, if you will. As soon as you move to group family, that's a licensed center. The requirements are a million times harder between that. It's a huge jump. And it's all about, most of it's about the Department of Health and like fire regulations, fire suppression systems, those types of things. So I will admit, yes, those are barriers, but I would say it's not all on the Department of Social Services either.
I can also hop into, so one of the problems, like, because you don't have to register with the state, like, while we like the ability to be flexible and allow people to run their business the way they want to run, and Kayla obviously addressed many of those concerns, but because we don't mandate registration of childcare facilities or in-home providers, there is a huge lack of comprehensive data. So we don't have a full story of what's going on in our state. It's really difficult to get a clear understanding of our population's needs. It's especially hard for people who aren't participating in traditional systems like Medicaid or other social programs, we just don't know. We don't know some of the gaps, even though we know that they're out there, because we don't even know the number of facilities, or not facilities, usually inpatient, or sorry, I'm inpatient. I'm getting into like my world here in healthcare. Usually in-home providers, we don't even know how many there are in our state. And that makes things incredibly difficult when we're trying to address concerns. So one of the ways that we're trying to solve this problem is connecting all of the different funding sources that are coming into our state. We've been working with a few different entities that are helping us pull that information together, so we have the most complete, I don't want to say comprehensive, but the most complete picture of what's happening in our state as it is, knowing that there are gaps in data and care out there, and knowing that we might never know what those gaps are because not everyone is registered with our state. Again, there's some benefits to that, and it means that there are some people out there getting care, but again, it comes down to at what expense, at what cost, because we want quality care for our kids here in South Dakota.
One thing, if you don't mind if I add, just from a consumer standpoint, it also makes it really difficult to find care. And one example I'll give of that is in Aberdeen, there was they have a city ordinance where they have a department within their city where they actually require city registration of any in-home. So you don't have to be registered with the state, but you have to be registered with the city of Aberdeen. And just to give you an idea of, in Aberdeen, there were roughly 30 providers who are registered with the state. But when you look at the city registration data, there's 52 overall. So just think about that as a consumer. If you're moving into town or if you are trying to find care as a parent, you literally have this hidden market where you have no idea where 20% of that market or 30 up to 60% of the market really even is, or how to find it. So it also really affects employers trying to find and help their employees find care as well. So thinking of it in that perspective too.
Thank you all so much for taking the time and just sharing your expertise and your experience in the world of childcare. We all know how critical this piece of infrastructure is for our workforce. And I will say we are so lucky to have the three of you share your experience, share your knowledge, and most importantly, have you engaged in the state of South Dakota to help really bring awareness and share this information so others that may be early in their stage of growing and development in this field has your knowledge in their pocket. So thank you so much. This webinar is going to be saved in our resource drive. The resource drive is full of all sorts of information that ranges from childcare to infrastructure to ideas for rural communities. And we would love to share that with you. If you are curious about our resource drive, head to porchlight-services.com/subscriptions, and you can sign up for a subscription service into our drive, or you can head to our website, which is porchlight-services.com, and subscribe to our newsletter. You'll keep up to date on what's happening on both the community side and the workforce side. Next month, our discussion is titled "A Look Behind the Curtain at Small Town Programming That Builds Community," and we'll have a whole new panel of experts sharing their success programs in their rural areas. Again, thank you to our panelists. Thank you to all of our guests that logged in to listen, and we look forward to seeing you all next month. Thank you so much.